Over the past week, Hawaii has reported more than 4,300 new COVID cases and 13 deaths. The state is seeing a slight increase in new daily cases. For more on what we can all expect, we're joined by Brooks Baer, the Department of Health's COVID-19 and Pandemic Response Administrative Assistant. Good morning, Brooks. Nice to see you again.
It's wonderful to be here with you.
So what does this latest report show? Because it seemed as if the numbers in Hawaii started to drop last month.
Yeah, the numbers had been coming down, but we are somewhat discouraged to see the data that came out just yesterday, because for the first time in 6 weeks, we see a slight uptick in the number of daily average cases, 574 new cases of COVID every day now. And of course, we know that's a drastic undercount because so many people are testing at home and those numbers are not reflected in the data we produce. But we've got a graphic to kind of illustrate where we are right now, where we've been and where we're headed. And, we had seen a rather sharp increase in cases that began in late March and it continued to early June. And it was a pretty steep increase. And then the numbers started to decline. We were encouraged, although the decline has been very gradual. But now suddenly the numbers, have they bottomed out? At least they've leveled out, at least for the moment. In fact, we've seen that slight increase. So the questions are really, have we bottomed out? Is this the new floor? Are we going to see numbers go back up? And what effect will that subvariant, the BA.5, have on what's happening in Hawaii? Because we know that a particular subvariant of the Omicron variant is more transmissible than its predecessors, and we expect a new variant report to be published by the Department of Health later on today. That variant report's probably going to show that BA.5 now accounts for, about 40% or so of the cases in Hawaii. And we know that BA.5 is by far the dominant strain on the mainland. And, usually what happens on the mainland happens here. And BA.5 is driving a surge in cases on the mainland. And so we're concerned about that happening in Hawaii as well.
So it does play a big role. Now, what about that fourth vaccine, Novavax? Because the CDC just approved it in the U.S. How is it different from the others? And when will it arrive here in Hawaii?
Well, as you know, the Pfizer and Moderna are those new technology vaccines, the mRNA vaccines. The Novavax vaccine is much more of a traditional vaccine. It's much more like the vaccine that is given to people for flu and for hepatitis. And we are hoping that some people who've been reluctant to get the mRNA vaccine will decide that they will get the Novavax vaccine. But it might be a couple weeks before we get it here in the islands. We're still waiting for word from the federal government on exactly how the rollout, the distribution will be. And there are ongoing meetings, but people should stay tuned to that. And we expect the Novavax vaccine to be here within the next couple of weeks. It's for people 18 and older.
18 and over. Then finally, Brooks, can you give us an update about the second booster as well as therapeutics?
Well, yeah, the second booster is just so very important. And our data shows that while everybody 50 and older is eligible to get a second booster, a lot of people just aren't getting it. And that's really tragic because about 90%, 89% plus of the people who are dying in Hawaii of COVID-related deaths are 50 and older, yet only about 26, 27% of the people 50 and older have received that second booster. So the message is, look, go out, get that extra protection from the second booster. President Biden tested positive, and you have probably seen that he is now taking a therapeutic called Paxlovid, and we want people to know that there are ample supplies of these therapeutics. So if you test positive, if you're over the age of 65, if you have some kind of underlying medical condition, and perhaps as much as 40% of us have one of these conditions, you qualify for one of these therapeutics. The important thing is, know that there are therapeutics available, know that they're effective, and do not wait. As soon as you've got symptoms, as soon as you test positive, talk to your doctor. You're going to need a prescription, but the key is to act quickly because you've got to have these therapeutics like Paxlovid administered within 5 days. So time is of the essence. Don't wait. Go seek medical advice, and it could be something that saves your life.
All right, Brooks Baer, thank you so much for joining us and for the live update and as well as those reminders. Always good to talk to you.
Great to see you guys.